Hello, 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 Dumelang. Welcome to Talk Africa, the voice of knowledge. Welcome to episode number 4. Yes, we are growing and I'm counting. Today, we have a very special guest in studio and we are going to discuss a very interesting topic. My guest is a specialist, a professional, an academic, a researcher. Most importantly, a psychologist. Dr. Lingani Mbakile Mahlanza, welcome to Talk Africa, the voice of knowledge. And thank you very much for honoring our invitation.
Oh, thank you so much for having me, and thank you for that very kind introduction. Thank you. Thank you for having me today.
Yes. Now, you are a psychologist.
I am.
An area of specialty that has always fascinated me. Because in my mind, a psychologist has always been this mind reader.
Right.
Yes. So I don't know if psychologists are able to sit down and have a conversation and walk away without figuring out what kind of a person that one was, one is.
Yeah.
Is that a typical stereotype that you experience as psychologists?
That is certainly a stereotype, and I really just want to clear that out. We don't read people's minds.
Please.
So psychologists are really not capable of reading people's minds. Our specialty is about behavior. Right? We're specialists in people behavior, in mental health, in child health, and so forth. So we definitely don't read minds, but we're able to help people with certain behavior concerns or mental health concerns.
Thank you for clarifying that.
Yeah.
So, because I think, I don't know where that came from, but because I think we always use psychology loosely.
Yeah.
But a lot of us, I think we know that psychology is something to do with the mind.
Yeah.
So that's why we just think, psychologists are mind readers, experts.
Yeah.
Now, what drew you to psychology?
What do we do?
What drew you to psychology?
Oh, what drew me to psychology? Oh,
Yeah.
wow. I never really know how to answer that question because it's so broad and so general. Basically...
because the question
was,
really, if I can interrupt you, we all grow up with perceptions or ideas of what field we should go into.
Yeah.
So for you, was it always a childhood passion or something that you later on in life realized is very important for somebody to learn about?
That's a very, very good question and direction. I wouldn't say it was a childhood passion. And to be very fair, I don't think when I was growing up as a child, I thought, I want to be a psychologist. No.
Yeah.
It's just as I was growing up and I was realizing that I had a really keen interest in people, in how people behave, in the differences that I see in people. I mean, like even within the same family, you could see that, even siblings would behave so differently. And that always really intrigued me. Like what drives us, what motivates us, what makes us feel sad? Why do we feel sad? Why do we feel happy? Why do we feel anxious?
Yeah.
Why do people have absurd thoughts? So those are the things that really, I guess it's just my curiosity that drew me to psychology. I'm actually trained as a clinical psychologist as well as a neuropsychologist. Yeah. So initially what I was interested in, it was, mental health. I am still interested in mental health, but things like, your depression, your anxiety, your schizophrenia, personality disorders, really assessing and treating people who've got those sort of presentations. Yeah. And as I was working as a clinical psychologist, I became interested in the real physical part of it. For example, what in the brain or what part of the brain really makes us behave the way that we do. So more concerned about biological factors more now.
Right.
Yeah.
And then you went and specialized on dementia?
I did.
So, and again, I'll ask, what particularly drew you towards this particular field of psychology?
Into dementia, yeah. So what drew me into neuropsychology, first of all, was my interest in the biological aspects of things, right?
Yeah.
The biological aspects of the brain behavior relationships, yeah? How to assess that, how to treat that, how to rehabilitate that. Yeah. What drew me into dementia, it's I guess it was just as I was, working, studying, and everything, I realized that in Botswana, we really have very, very, very little information, very little knowledge, very little resources when it comes to geriatric care. Right? So I had two grandmothers who unfortunately passed away closely after each other, right?
Yeah.
But both my grandmothers grew up to 98 and 99, right? And they never suffered with memory issues. They never suffered with, dementia. However, I've got my friend's grandmother who was at 68, started to suffer with, memory issues.
Yeah.
So I was interested, is this like an age thing? If it's an age thing, shouldn't the older generation be suffering more with memory issues rather than the younger? Like, shouldn't the 98-year-old suffer more than the 68-year-old, for example?
Yeah.
So this is why I started to, become more curious, to want to investigate, what is this thing called dementia as part of, geriatric care.
Great. And what you just illustrated there, today's show is going to be a bit different from how I usually do it, because to our regular listeners, usually our conversations are in English. But because still with its universal relevance as it is, dementia, I think, it also resonates quite well with people here at home.
Sure.
So because of that, I'm going to do something different and do a mix of languages.
No problem.
Yeah, and especially that we're talking about something that affects Baholo.
Yes.
So data right now shows that universally or globally, people are living much longer, which is a good thing. I mean, the whole idea behind development and human development, when people live longer, when more children survive.
Yes.
But as these things happen, we now have more older people surviving, who now start to experience some of the things that adults experience. So dementia, if we were to describe it, I know some of these concepts don't seem to have language, but
what is dementia?
Yeah.
And just before I go there, Oli, I just want to perhaps cement Sosibuiling, because I think it's very important, and I want to highlight what you said.
Yeah.
It's a win for medicine, it's a win for public health, the fact that we are seeing our population age, right? Bagolo ba rona ba tshela for longer.
Yeah.
It's a win, right?
Exactly.
Medicine, public health, everything, it's great. But with that, it means we're getting more older people by long they are affected by diseases of older age.
Yeah.
One of these diseases of older age is dementia, right?
Yeah.
And just before dementia came, I also wanted to highlight this a demographic change, right?
Yeah.
The demographic change, we're getting more people who are aging. And then that change, we're seeing it more in Africa and other low and middle income countries.
Yeah.
The world's aging population increase thing is more within our communities, more within low and middle income countries, as opposed to
Maybe
industrialized nations, the Western world. And maybe later on we'll talk about what that means for us.
Exactly. Yeah.
So what a problem is, it's a problem that is inherent in our society, that we need to deal with.
Yeah.
It's existent in other parts, but in Africa, it's a bigger problem.
Yeah.
Okay. Sorry to go around there.
No,
but
that's
so
actually
you had asked
perfect
what
foundation today. Yeah.
What is dementia?
Yeah.
Dementia ka Setswana, we don't have a translation as Setswana, but what I can say, yeah.
Yeah.
So dementia is an umbrella term.
Yeah.
So we can't really say only onale dementia.
Yeah.
Because when we say that, we're not really being specific and we're not really communicating much.
Yeah.
So that's why it's an umbrella term.
Yeah.
So motohanale dementia, they have a certain type of dementia. You understand?
Yeah.
So dementia is an umbrella term that describes different diseases.
Right.
Right?
Right.
Under that umbrella, we've got different types of dementia. We've got Alzheimer's disease. The Alzheimer's disease.
Yeah, it's more familiar.
So how about the Alzheimer's disease? We're talking about a certain type of dementia. We've got other dementias. We've got things like Lewy body dementia. It's a different type of dementia within that umbrella.
Yeah.
We've got frontotemporal dementia, which is another dementia within that umbrella.
Yeah.
We've got vascular dementia. So all these different types of diseases
Yeah.
have different causes of the dementia.
Right. And under that umbrella, do we then have a spectrum that transcends different ages? Like, can you say more age man dementia ya gore e common? More age, do we have such?
That's actually a really good question. It's not so prescriptive per se,
Yeah.
but for example, Harlibile Alzheimer's disease, it usually affects people who are much older.
Yeah.
You understand?
Yeah.
So people may be from 65 and above, usually. And I say usually because sometimes we do get Alzheimer's disease, we call it a younger onset Alzheimer's disease. And then a different type of dementia, for example, let's say, for example, Lewy body dementia usually affects younger people.
Yeah.
So
Younger, how
Alzheimer's-
young?
It depends. Like I've heard of cases where people are 45, 50, have
Yeah.
Lewy body. Even frontotemporal dementia, we see it in younger populations as opposed to Alzheimer's. So Alzheimer's is more associated with older age,
Yeah.
whereas other dementias
Yeah.
may be associated with a younger age.
Right.
And when I say younger, I'm not talking about young adults. I'm talking about adults still, but not like over your
Not
65.
over. Yeah.
Yeah.
So you know this one year affect number to about 45. What are the typical symptoms there?
So I can get like so for
Ke
example,
diagnose.
So for example, we've got this one a frontotemporal dementia, right?
Yeah.
So what frontotemporal dementia, you know, I wish I had a brain here with me, actually a model of a brain.
Yeah.
But your brain is kind of roughly divided into equal parts, for example. And then we've got the front part of the brain, right?
Yeah.
That part of the brain is responsible for certain things. Things like decision making, things like your behavior, things like personality and so forth, right? So when dementia or when disease affects that part of the brain, the symptoms that you're asking, for example, you'll find that there's a lot of behavior change. Oligana used to be a person who is so bonolo. Why is he such an aggressive person? So behavior changes, decision making starts to change. So
So you can actually move from a more bonolo ya kanobua to a more maybe aggressive.
Oh yeah, absolutely.
Because I'm more thinking of slowing down, kind of.
Yeah. No.
Okay.
Yeah, you can. You
Wow.
can with frontotemporal dementia.
Yeah.
You can. Yeah.
Okay.
Yeah.
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 And then from that one, the next one, then because nowadays, especially rona ba re golang ba re tsena into that space where you are raising children of a certain age, and then the responsibility di a oketsega.
Yeah.
You tend to see yourself forgetting dilo tse ntse o sa di lebale, So then once you start to learn about dementia, is it dementia?
Dementia.
Right? Yes.
Dementia.
You start to worry, okay, I can gape o ka re tshaba go tsogala rona batho ba malatsi a. So we stress a lot about bo go lebala, and sometimes it comes from other people.
Yeah.
You are there, you're like, oh, I was supposed to do this kelebets, ne ke batla phone ke ntse ke e tshwere. And then people keep saying it's old age, we are aging. So it's like our generations, especially batho ba ba lekanang le nna, it's like we are more conscious and worried about aging.
Yeah.
I don't know if it's just me observing that.
Yeah. And I just thank you for raising that, because what we also need to highlight, dementia is not a part of aging. Right? As you're saying, in our society, it's almost like dementia is synonymous with aging.
Yeah.
But what we need to realize is that dementia is actually a disease. It's not a normal part of aging. You and I are aging. Right?
So it's not like
everybody's
just
aging.
It's not like just because you are aging, you're gonna get dementia.
No. No. So dementia is a disease process, right?
Yeah.
So my brain might have the disease, your brain might not have the disease. We're
Yeah,
both aging.
more like the prostate.
Exactly.
Kind of,
Exactly. It's a disease. Yeah, like prostate or heart disease or whatever.
Yeah.
It's a disease.
Right.
So it doesn't mean that everybody who's aging or everybody who has aged will get dementia or has dementia.
Yeah, because I think sometimes it's the ignorant attitude is more like dementia. Cross a line.
No, yeah.
Okay, yeah, that's important to clarify. And so now we have people who are taking care of batho ba nang le dementia, and that's obviously a problem. So, and the conversation that we are having, I think, is important for especially caregivers tsa bagolo. Gore ha o na le mogolo, botlhokwa ja teng ja gore o kgone go nna le understanding ya gore my parent or my grandmother could be going, because ha gongwe ka Setswana, hey kana yo wa lapisa kana wa ba lebetse gore gona o ka re mogolo o na le is a problem adult. Instead of rather than realizing she's actually going through, it's like acting in a certain way without that awareness. Motho is actually dealing with something. Therefore, the care might be different. So, knowledge, I might actually deal with something. A lot of our people probably don't have it. I mean, I didn't have it myself, or I still won't be able to completely or competently say, okay, moto udilale such and such a thing. Now, coming to Kanya gore, most society in Sarona, we have jaga society we have the what are they called? The superstition in Sarona. And you find that most of the and then the way we describe dementia and some of the symptoms. Actually, when you started, you mentioned it's condition and I'm here thinking, what are the chances that mogolo yo na le dementia, depending what I'm staging say, could actually find themselves home atimela tsela ya malatsi o thela a ba go tsana go a iphitlhela tsene mo jarateng e sele and then ka mosoebe go te hey wa mosadi mogolo e bile malatsi ya o setsa o lo ile dingaka o setse ile tsa tsana mo dijarateng tsa batho.
Exactly. It's a real problem, and I think I think a few weeks ago there was something more social media. I can't remember what village it was. This lady turned out the lady likely had dementia. So our conversation in terms of dementia. It's only the stages of thinking.
Exactly.
You also talked about caregiving and so forth. So kind of with dementia, I can hey, this person whatever, you know, I'm forgetting my keys, I'm forgetting where I've put my purse or whatever. So dementia in a little stage, right? So dementia we're talking about, it's a neurodegenerative condition. Neurodegenerative. Neuro I get your brain and your spinal cord. Degenerative, something is getting worse over time. Right? So your symptoms are mild. For example, let's say for example on phase 2, but all of a sudden you don't know how to get to the store. But you've been living there for 10 years, you've always known, all of a sudden you can't do that yourself. You can't drive yourself to work. In your environment. You might start to forget your kids' names and so forth.
Things that you never struggled with.
Or we classify it as mild cognitive mild neurocognitive impairment. But really, it's neurodegenerative, I get.
Yeah.
So things get worse over time.
Yeah.
So you'll find that your symptoms get worse.
Yeah.
I get. Your wallet, whatever. Now, for example, you might start to forget your neighbors' names. I get.
Yeah.
Or
even your
you
children's
you forget right? What's happening to your safety?
Yeah. Yeah.
Things like that, right? Hindsight progress, and this might take years, especially Alzheimer's disease.
Yeah.
It's not something saying families have reported change. They are happening over time, but right? To the later stages of dementia, where maybe the person can't even remember their own children's names.
Yeah.
They can't care for themselves. They can't bathe themselves. They can't feed themselves. So those are the later stages. So it happens in stages.
Yeah.
It's mild, moderate, and then it goes to the severe stages. And unfortunately, it does lead to death.
Yeah, like other diseases or
like
other conditions.
Yes. And you had, I wanted to also touch on caregiving because no.
Yeah, yeah.
So obviously, you can imagine, has dementia and caregiving needs didn't over time. I can't mild, severe.
Yeah.
So now, this person I'm caring for has higher needs, right? They now can't make decisions for themselves. They can't bathe themselves. They can't go to the shop by themselves.
They're dependent.
Yeah? And we know in today's society, now families are kind of dispersed. You know, we don't live in those close-knit families like before. In a household, 10, 12 people.
Yeah.
Right now, you'll find a typical household with mom, dad, 2 kids, whatever, right? So what happens? Care needs dwell onto fewer people.
Yeah.
And
if they're available.
If they are available, exactly. And then that ends up creating a caregiving burden.
Yeah.
Yeah.
Absolutely.
Caregiving burden, what happens to my mental health? I get stressed. I get anxious. I need more days off of work.
Because you have more things to worry about.
Yeah. And in our society, we don't have many resources. The caregiver, right? We don't have, care homes. We don't have resources and so forth.
Yeah.
So it becomes very difficult for families by they have someone with dementia.
Absolutely. And now, we were talking about the stereotype earlier on.
Yeah.
As you were doing your research, have you come across those?
Yeah.
How ntse o dira research, gore dio tse re buang ka tsone re ba tsona ba na le ditumelo tsa bone tsa gore ha motho a nna jana ha ngwe go tudile diphate tsa ngwana mo gore na le explanation for sengwe le sengwe.
I believe.
Have you come across those regarding research?
Definitely.
Dementia itself.
Definitely. So what we often do, so right now we're doing some research in local communities here, like just to kind of try and advance neuropsychology in Botswana. And we quite often hold the meetings, right, to spread information. And one question that always comes up, beliefs, people's beliefs about dementia. I can't the symptoms of dementia. So how when the symptoms are dementia, for example, in the moderate or the severe stages, like moderate because I'm severe, usually banna bedridden. So moderate they become, due to lack of a better word, become confused. The other thing about it is that their memory, what was intact. Well, usually.
So they tend to remember more of older things.
So for example, let's say this is an 88-year-old lady, 10 years old. In their life at that time. Chances are those people have passed away.
Wow.
batho ba teng gape, the other thing is they get agitated bosigo ba tsoga. I get confused. You might find gore motho a teng wa tsoga bosigo o tsena mo kitchening o leka go apa.
Yeah.
Because their mind is telling them this is the thing to do.
Yeah.
Right?
And I tell them nako ke 4 ile 12 bosigo. Yeah.
How were they forgotten that they now live in a modern home that has a bathroom montu? Motho o tswela kwa ntle ka gore gakologela gore kana ba bathroom is outside. How mo ba ibila tswa ka gate. Right?
Yeah.
Sometimes they're not even dressed.
Yeah.
You know, motho na robits.
Wow.
So you can imagine how motho tla ba ya ko neighboring because they're confused about something.
Yeah, because we do like a khoro.
O dule ka khoro, So neighbor ya tsoga e bona motho kyo
Kana
ga dinjadi a bogola motho go ga ga bosigo, they're undressed. You know, they are trying to cook at night. Motho ke moloi. But we must remember those are symptoms of dementia. That person is actually exhibiting some of the symptoms that come with dementia.
Yeah. You know what you just explained, it's very scary because you know it makes me think of, you know, how sometimes you get married to another person. And then your mother they are quite advanced in age.
Yes.
Is going through dementia. Yo mongwe in-law wa tsoga bosigo wa go bathroom mo kopana le parent-in-law mo kitchening wa apa. Ka moso matsale wa lowa.
Exactly. Yeah. And I think this is something that we really need to highlight to people. You know, dementia has symptoms. The symptoms are thing describing, you know, you know, it's not witchcraft. You know, these people need to be looked after. You know, in a village, you know, when you encounter something like that, approach that person with a bit of compassion. You know, obviously make sure you are safe, and as an individual, but approach with compassion. You know, do they need to be taken to the nearest health facility? Because dementia is real, it's there.
That's so crucial because, you know, and this is part of the reason, by the way, I started Talk Africa. Because part of it really is to deal with some of these myths that are too saying as a society. Sometimes they even defeat our development, you know, objectives. There are these things that instead of taking better care of people,
conflict, exactly.
Because raba label, raba bitsa maina, you know, you know, balo and stuff like that. So this is more than golden knowledge that you just shared now. Because compassion, it's supposed to be our nature. Regardless of whether dumela gore motho ole o fita a certain description, undesirable. Your natural instinct, unpolluted, should be to rescue that person from that situation. But you cannot rescue them or what are they going through.
That's actually a very good point. And I think how when we act these ways because we lack knowledge. You know, you know, this is something that's really not dementia is something that people don't understand dementia, they don't know how it presents, how to look after someone with dementia. You know, so I guess what you're doing is golden, Oliluena, for, you know, to be able to create these platforms where people can spread knowledge. I mean, the more, the knowledge is power, right? So the more we know about dementia, about the symptomatology, the way it presents, we're in a better space to be able to be compassionate to people who are suffering with dementia.
No, thank you, especially coming from a professional. You earlier were talking about, you were using, I think you'll correct me if I didn't get it right, the I think you were saying something like
neurodegenerative?
Yes. The degenerative term. Kind of regressa. I understand there's a point where lose, is it the neurons or basically in terms of capacity to function well. So I was going to ask you, if that is the case scientifically, is there a possibility ya gore ha ke ntse ke gola ke nna le di responsibility gongwe ba go nna le some added ones ke be ke nna le stress can that actually affect the rate ye ke ye bo boko ja me bo degenerate kana go degenerate jone kana but I know you I hope you can get what I'm trying to say.
I really understand where you're going
kana
with
that
this,
thing e iragala naturally
Yeah.
the degeneration
yeah.
it's a matter of timing or at a certain age it will happen.
I think maybe let us drive this conversation towards what is the risk, the risk factor.
Exactly. Yeah.
The risk factors that this neurodegeneration idiragale ke se causang gore go nne jalo.
Yes.
You know?
Exactly. Yeah.
So before we had said you and I are aging, right?
Yeah.
So obviously our brains are not functioning the same way they were functioning 20 years ago.
Yeah.
Right? And that's normal.
Yeah.
Right?
That should happen.
And we pray that even when you and I are 70, 80, we still will be functioning. Our brains will not be functioning the same way they are functioning now,
Yeah.
but they will be functioning normally for 80-year-olds.
Yeah.
Right?
Yeah.
So go na le gore boboko bo ska functiona kana bo functiona but ese bolwetse. I get
Yeah.
has neurodegeneration. Ha ke bua ka neurodegeneration, I'm talking about a brain that has been affected by disease. I get
Yeah.
So for example, ka re bua ka yone Alzheimer's disease yana.
Yeah.
It's a genetic condition, but the cause of it usually
Yeah.
the gene. So ha ile gore ke na le that gene, obviously the neurodegeneration ya go diragala more than the average 80-year-old at the
person.
time.
Yeah.
So
Yeah.
just because ke motona boboko ba ka bo godile doesn't mean gore ke a go nna le disease eo.
So like you were saying,
Eh.
it's a question of whether you have it
Eh.
or you don't. Right.
And then you also said something very important gape o bua ka gore how ka nna le stress.
Yeah.
Which is why I wanted us to talk about
causes.
some of the risk factors.
The risk factors, yes.
So maybe I don't want to say causes, but risk
Risk factors, yes, yeah. So you go expose them to that.
So a lot of research is happening, but around the world in terms of risk factors.
Yeah.
Dementia. I can batho for a longer time.
Yeah.
We're seeing more incidents of dementia. So research here direct.
Yeah.
And unfortunately, a lot of that research is not happening in our region, but that's a story for another a day.
Yeah.
But there is some research in Africa. So some of the things we've noticed are risk factors are things like depression.
Yeah.
No wheel about stress.
Yeah.
I get something sa diragala mo botshelong ba gago o nna le stress is that going to cause your brain to regenerate,
Yeah.
to degenerate, not
Yeah.
regenerate,
Yeah, degenerate quicker. Yes.
So depression is definitely a risk factor. We're not saying what about Obama and depression are going to get dementia. We're saying
Yeah.
it increases your chances
Yeah.
of that degeneration happening.
Yeah.
Okay.
Or it even accelerates it if you have that condition.
Thank you.
Yeah.
Exactly.
Yeah.
Social isolation.
Yeah.
Our communities now are becoming more and more socially isolated.
Yeah.
Yeah. One example I like to give, some research was done, and then it was found the brain of someone who is socially isolated
Yeah.
is similar to the brain of someone who smokes 15 cigarettes a day.
Wow.
Not a social isolation
Yeah.
is detrimental
Very.
to our brains.
Very. Yeah.
So it's a huge risk factor
Talking
for
about that,
dementia.
which takes us now to, the way our society is constructed, especially lifestyle. It's about holobaron. There is this thing that I always pick up. I watch football or sports in general. One of the things that I pick up, football, especially English football, is the number of very old people that I'm able to see in the stadiums watching football, and then that always takes me to because I do go to sports events here. I go to stadiums. I don't see them. But what I know is that at the average wedding, at the average funeral, you will see them there. Now, how often do you have those things? If you take away lenyalo, le lesu, bagolo ba rona ba spenda nako kae ba ira eng ba le mo seemong se sa maikutlo, are they happy wherever they are they feeling safe, are they comfortable? And my suspicion is that if they are not at these events, they are probably lonely somewhere.
Exactly. Yeah. Very good point. Kana these are systemic things, right? So tota hanze re bua gone ka gore and another thing right now ke gone gore we don't have the cure for dementia. So what we can do really ke gone ka go prevent. So you're saying a very good point gone gore bagolo ba rona, what are we doing? How are we helping them, and how are they helping themselves to not be socially isolated? Because this is a huge strategy in terms of preventing your neurodegeneration in Zenrubuakayon.
Because recently there was a study senense presentiwa ke Professor Ntsiane about care yone ya batho ba ya bagolo.
Yes.
And it had very interesting findings. Of course, a lot of it had to do with it was touching on issues that were welfare ya bone, what they get, especially in terms of pension and things like that. But now, obviously, we're talking lifestyle as a factor. Earlier on, you were talking about the fact that society is not changing. Bana ba bagolo ba riwang ka bone. Ke batsadi ba nako ba nnang teng bana le bana ba bone ba bereka ko bagolo ba rona ba rate go nna. A lot of us wish we could take our parents ra go nna le bone, but they don't want that.
They want to be in their own spaces.
In their own spaces.
Yeah.
Now, if your lifestyle, is it then not taking us to the point there gore you know gompieno nna lo yana ra bereka gate gona le retirement planning, gona le pension. I don't know how many people ba reng ha ba akanya pension kana retirement planning. Most people think about having enough money to buy food and medicine. Maybe in some cases travel. Have we not come to a point there where, look, the person who is supposed to be your relative at our tokomela, like it was before,
Back then,
that is the reality. But or thing, but ha available. So shouldn't we then be moving away from that care thing? Because I go bua hala casual go thing. Batsadi ba lathile ba bana ba lathile batsadi ba ba thokomologile. Ha o romela motsadi wa go madi every month a dijo. Me go sena motho o mo thokomelang ho. What does it help? Ke ma make sure gore dijo tsa di jang ha ile re o kgona go apa o kgona go tsamaya go di reka go re thokomelo ya go ya tsatsi le letsatsi.
Their medication that they're supposed to take, are they taking it properly?
So shouldn't we be thinking about a life where now ono thokomela bana, that is the professional now planning. Ne ke thokomela bongwana ke duela di school fees. Now post retirement, I'm going to need a helper. Yo ke mo hirileng ke mo duela. My children will still come and see me when they can. But you know how our society is like. A lot of people ba ba sa kgone go thokomela batsadi ba bone ba dumela gore ha ka ke ba hirela batsadi ba bone helper. Part of the problem being we also have relatives who are unemployed. They would rather come and stay with you, Lingani, and live in your house, live off you for free, than have you or like ka re ke le mogile gore tata bana di tsa go bereka se dio tsa gago. Nna le rakgadi ya go ko ke go duele. Re akanya jang Dr. Mbakile Mahlanza, because you deal with issues of tsa tlhaloganyo. Re processa dilo yang as a society. Ke eng go le motho go gore your relative abone it's like it's a natural thing. As a relative, I want to live freely off you
rather than
go and help and actually be rewarded for that. What happens there?
I don't have an answer for you. I have no idea, to be
Yeah.
honest with you. But and I know this is exactly what happens.
Yeah.
So whether you know what benefit is it of me, is that going to benefit me? Is that going to I don't know.
Yeah.
But I mean, these are conversations that we really had to have at a family level, right?
Yeah.
At a social level. Or how do we do things? How do we run our families, our societies, our lives in ways that are going to be beneficial for everyone across the lifespan?
Yeah.
Right? Beneficial to the kids, to the adults, to the grandparents, to the great-grandparents.
Yeah.
They're very important conversations.
And I think mo thabologong ya rona mo kana mo sepeng wa rona go thabologa as a society. It's like we are hesitant or afraid to face certain realities. You know, we are so stuck, in my observation, with this thing. Yeah. You know how ngwana Motswana would say, "How I feel gore tiro ya berekang." I mean, we sound like we are veering off topic now, but this speaks directly to issue ya go tlhokomela bagolo. Ngwana Motswana would say, "Nkampa ke go sotagala kwa ga mme." This is us and the way we process things. So what I'm getting to is there something about our family construct to solve the problems? Because to me,
I don't know. So how I wonder whether it's, you know how, you know, if you were to have this conversation 20 years ago, the structures of our families were very different. We were more collectivistic.
Yeah.
Right?
Yeah.
It was about, you know, my cousin, my brother, my sister, right? We were more collectivistic, right? Yeah. Whereas now, as we said earlier, we're really becoming quite individualistic.
Yeah.
So go again, my little.
Yeah.
So maybe that is something, and then. I mean, there's a lot of reasons why that happens, you know, especially like industrialization, people have gone, looking for work elsewhere, people are looking for better opportunities.
Yeah.
So that essence, that thing, the way I believe, and I think most people would believe it has changed.
Yeah.
The way our family structure has changed.
Yeah.
But yeah, no, I think what we're getting at is the psyche behind all of that.
Yeah.
Why?
Yeah. Because practicality and reality is always running ahead of our, you know, the way it's in thing. And going back to Kanya you know, mathoki ya bagolo ba ileng gore ba affectwa ke yone dementia or other later life conditions. How do we get these issues now into, you know, formal conversations, like whether we're talking about policy, employment, because hari hirwa go tirong gona le pension provision
Yeah, good question there.
Yeah.
So I think Oli what needs to happen. I mean, nothing happens right?
Yeah.
In my opinion, we need research
proof
to be able to say this is what is needed. Let it go to policy. This is, you know.
Yeah.
So for example, like the risk factors.
Yeah.
So what are the things to prevent the dementia?
Yeah.
I mean, we only talked about two of them. Social isolation, social isolation here.
Yeah. Yes.
Things like diet, right? Having good diet, balanced diet, reducing sugars, physical exercise, being cognitively engaged at all times. So how does that read? So those things they are to either prevent or to reduce the rate of decline, dementia.
Yeah.
You know, these are things that we can put forward and say to policymakers and say, I mean, in other countries, those that research has been done.
Yeah.
It has been found, for example, a control of blood pressure, you know, reducing sugar intake, exercising, eating balanced diets, and so forth. go reduce by 40%.
Kore a
The
le healthy.
progression, a le healthy.
Yeah.
So what's good for your heart is also good for your brain.
Yeah.
Right?
Yeah.
So those are things that we can actually take up with our policymakers and say, how do we now make sure they are rolling out? You know, how do we, as scientists, as researchers, this is what we have found.
Yeah.
How do we now make sure these things are now translated into policy?
Yeah.
How do we now make sure they are rolling out to the same way to kagala, gumare, or whatever.
Yeah.
So it's conversations that need to go to that
happen.
level.
Yeah. And even the way we look at how bereka on a the benefits on a pension and the focus is always more down the road. And the truth is that pension is going to be way less than what you used to earn. You have made it, therefore you need less. When you actually now need more
because
care.
your care needs they are go dim, right?
Yeah.
So obviously, if as you age, and especially if you do get disease, your care needs go higher.
Yeah.
So you will need more money to be able to survive. You will need more support to be able to survive.
Yeah.
Yeah.
And at the moment, what is research showing us, Hela, about the future on dementia? How really the trends, it's a thing. Does it look like we face, more? I mean, obviously, a lot of these conditions, hence the population is around you, everything seems to grow. But
Yeah.
how level it's a thing in terms of the intervention? Do you think we are in a position to cope with this going forward with the issues of dementia? What does this picture look like if there's such data at the moment?
Yeah.
Or is it something that we should look into?
So tota only what the projections they're showing that by 2050 2026
yeah.
So by 2050 let me just bring it back to Botswana.
Yeah.
So mo Botswana, our aging population is going to increase by 238% by 2050.
Yeah.
What does that mean? It means dementia are also going to increase tremendously.
Of course.
Tremendously.
Yeah.
Are we ready for this? No,
That's the question. Are we ready?
we're not. So I feel dementia is going to come at us like a tsunami. It's coming at us. I feel our health system is not prepared. We're not resourced. Diagnose dementia. We've been talking about dementia.
Yeah.
How many people have dementia in Botswana? I cannot tell you.
Yeah.
The research has not been done. People are not diagnosed.
Yeah.
Right? So diagnose it, because obviously you know that with diagnosis we can help people better.
Yeah.
Right? So we're not even able to correctly diagnose because the resources are there.
Yeah.
Up until a few years, diagnosis as an example.
Yeah.
So to diagnose dementia, for example, certain things need to be done. I get clinical examination, a neuropsychological assessment, sometimes blood tests, sometimes like neuroimaging.
Yeah.
So in first world countries, they're developed, they have all those things to be able to diagnose dementia.
Yeah.
Moharona, or in Africa at large, we really don't.
Yeah.
To give you an example, up until a few years ago, we only had one neuropsychologist in Botswana. Now we have two. How big is our population? But a neuropsychologist is someone who they are part of the system. You cannot diagnose dementia without a neuropsychological assessment.
So there's only two of you.
Yes.
As we speak, nationwide.
Yeah.
In a population of over 2 million.
Exactly.
Yeah.
So we're not even diagnosing appropriately.
Yeah.
Because ha gona di resources to diagnose. So as a healthcare system, are we prepared for this tsunami that is coming at us that is called dementia?
Yeah. And our training efforts, the fewer experts we have, the lesser the capacity to train
Yeah.
more future psychologists like yourself.
Yeah. Of course, but obviously, we have collaborations with people, from outside which could collaborate to train. And I think for us to be able to challenge this thing that's coming at us is to train more people, like you're saying, right? We need more psychologists as a whole in our country. Like even our mental health system, we know that, for example, for 6 months to be seen by a psychologist in the public system. Even when you're presenting with seemingly urgent cases. So we need to train psychologists. We need to train specialists like neuropsychologists for us to be able to increase capacity to be able to deal with dementia.
And what you just said now about the acute shortage of expertise is just scary. I mean, here we are. I'm talking to you, Ole, a psychologist, but in terms of research, you have focused on this area quite significantly, dementia. But then we have a whole spectrum of psychology specialties. Child psychology, issues about they're exposed to drugs. Another situation that is exploding on its own.
Another tsunami.
So we really are in trouble then as a country, if I was to put it that way.
Yeah, absolutely.
Wow. Now, if you could give a message to families that are dealing with, I don't even want to say people with dementia, but families that have adults, which every family is at some point is going to have one anyway. What would you like to say to them?
Especially, I guess we're talking about, for example, if it's a family and they're dealing with someone who's got dementia, I guess. You're not alone. There's help out there. I know what we've been talking about, the lack of resources and so forth. But we do have, because I know there's a foundation, Ibidwa Pelonomi Foundation. It's based in Gaborone, but they're about to go, nationwide. Foundation. So there are places that you can actually go for support. So, and especially for Zonedi caregiver, I think it's very important to reach out, to seek help, to seek information, because caring for someone who's got dementia is a really, really tough ask. It's tough emotionally, it's tough financially, it's tough socially, because sometimes you might find because they've got these big caregiving needs. So what I can say, you're not alone out there. Seek help, seek information, and also seek each other, amongst families. Being closely knit and helping each other is probably the best way to do it.
And that appeal for people to seek help. I mean, you just painted that picture, if I can use that. Do you happen to have any association in the country to amplify your voice?
Yes, so so there's two organizations they deal. So the first one is Pelonomi Foundation. So what they do, it's an NGO. They really seek to support they've got dementia.
But I was asking more in terms of maybe association of psychologists or something. Is there a body like that in the country?
Yes. Of psychologists, definitely. So we've got association of psychologists, but of neuropsychologists, because I get thought that dementia is more neuropsychology. So because the neuropsychologists, we've only just started really we're registering, we've registered. So we're registering like an association of neuropsychologists, and we're hoping with time this is something that can grow, and it will be a platform for us to support people, to share information, form support groups and so forth, for this to bounce out of this. So keep an eye out. It's definitely something that's in the works.
Because I mean, I am definitely one of your cheerleaders
Thank
because
you.
you need all the voices that you can get
Thank you so
after
much.
you painted that picture of what the future looks like, and also the reality that we know. So, Dr. Lingani Mbakile Mahlanza, thank you so much
Pleasure
for
is
sharing
mine.
that. I mean, gold is overrated sometimes, but golden knowledge nevertheless.
Yeah.
We appreciate that knowledge, and we look forward to having you again, because I'm sure we're going to have you again.
Thank you. Thank you so much for having me. This has been great. And I'm hoping that, we've spread some information to people out there. And as we both believe, sharing information, sharing knowledge is the first step into improving people's lives,
Indeed.
people with dementia.
Indeed.
Yeah.
And to our viewers, once again, thank you for gathering by the Talk Africa fireplace. If for any reason in the past you have not had a reason to share this platform or this information, I hope today's podcast, or today's episode rather, is one worth sharing, because it's so topical regardless of where you are. Thank you once again for supporting this channel. Do like us on Facebook, follow us on YouTube and like it. Thank you very much for joining us. Thank you.